Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about amputations. Today, I'm going to talk to you about our amputations preventions and limb salvage program, or in many ways, we work to avoid amputations when the legs are threatened by circulation problems. Many people have heard peripheral or arterial disease, or PAD, a disorder that occurs in the arteries of the circulatory system, also called the peripheral vascular disease, atherosclerosis, or hardening of the arteries. These conditions can cause narrowing or blockages in any blood vessels outside of the heart, especially from the admin down to the legs. Limb salvage is essentially how we identify, diagnose, and treat severe peripheral arterial disease that can damage the tissues and eventually lead to tissue death, which can require amputations of the part of the leg, foot, or toes. Unfortunately, in PAD, vague symptoms may go undetected until disease has reached a fairly advanced stage. Some of the most common symptoms are pain in the legs, buttocks, in calves, which can be quite severe even in the rest and limited your activities. Other symptoms can include swelling in the legs, feet, or ankles, ulcers or sores that won't heal on your legs and ankles or toes, colder, painful feet, and tingling or numbness in your lower legs or feet. Therefore, educating patients in the first line provides about early symptoms is the key. If you are diagnosed with PAD, early interventions is critical. Limb salvage efforts will begin lifestyle modifications, controlling high cholesterols, high blood pressures, diabetes, and quitting smoking are the first steps. Those with diabetes need to be especially vigilant. Not only are those with diabetes 2 to 3 times more likely to develop PAD, they are also 2 to 3 times more likely to undergo amputations compared to someone who does not have diabetes. Following a healthy diet and exercise programs are also important. Besides lifestyle change, there are many interventions that can help those with the PAD. There are minimally invasive procedures which may use as a balloon to open the blood vessels, also referred to as the angioplasty, and a stent to hold it open or to cut off the blockage, referred to as the atherectomy. In some cases, surgical procedures such as peripheral arterial bypass surgery may be performed to reroute blood flows around the blockage. Your physicians will determine the treatments which is best for you based upon the locations of the narrowing or the blockage, its severity in your overall health. In many instances, we can now use minimally invasive technology to open blood vessels that were previously untreatable. Currently, up to 75% of patients with limb-threatening blockages qualify for minimally invasive procedures. In some instances, less invasive options have equal for better durability than a traditional open bypasses. Whether minimally invasive or open-close monitoring is needed to check for restenosis or re-narrowing of the blood vessels. At the Cleveland and the clinic, we have a long history of performing a high volume of both open and minimally invasive machines. Outstanding to outcome are our results. Experts continue to develop innovative technologies for both everyday and complex circulations problems. We also provide specialized wound care, not widely available, including the hyperbaric oxygen using a multidisciplinary approach, and we work not to only improve the circulations, but also use advanced wound care measures. To get these wounds to heal, which is the ultimate measures of the success, technology to treat vasculars, narrowing, in the blockages is rapidly improving. Technology to treat vascular narrowing and blockages is rapidly improving.